India is a registered dental hygienist, infection control and HIPAA educator, and OSHA and abuse awareness trainer. She is the founder of Learn to Prevent, a dental compliance company that equips dental teams with tools to deliver the safest dental visit possible. She has worked on projects with the CDC Office of Oral Health, is an editorial review board member for OSAP and Inside Dental Hygiene, and serves as a CDC inspector for the Maryland State Board of Dental Examiners. Welcome to the podcast, India.
Thank you so much. I'm happy to be here. I'm excited, actually.
Oh, good, because we were just talking about excitement before
Yes.
we began. So
Right,
we'll
exactly.
see if we can keep that rolling through our
Yes.
conversation today. So I found it interesting just learning more about you and kind of reading on some of these things that you're passionate about. And so you're a safety advocate within dental practices, and you have some concerns that safety isn't always taken seriously enough, at least by some part of the dental population, right? So,
Yes.
so what do you think is driving this issue, and how do you see it affecting patient care?
Well, I think sometimes, as far as, I can't always expect everybody to be so passionate about dental safety as I am, but I think sometimes it does get put on the back burner a little bit, just because in the way that we go about our schedules from day to day and things like that. A lot of times we're on autopilot and we get into like the routine of how we do things. And I would say that the oversight isn't always there, for the dental industry, the way it might be in other industries. And so typically in dentistry, everything is complaint driven. So if you never get a complaint, there's really nobody that's going to come in to kind of, you know, uh, give you, any type of inspection or, anything like that. And so I think we fall short there in our industry. I would love to have more, random inspections, things like that, similar to the restaurant industry where you have a restaurant inspector come and making sure that people are, doing the right thing. And so while I don't think that people do it on purpose, to, turn a blind eye or skip steps or things like that. I think it's just the nature of the human factor in dentistry. It is still very, very important to make sure that we are doing things according to the rules and regulations. A lot of these rules and regulations have been put in place not to make our lives harder, but really to protect all of the stakeholders that are involved, the clinician, the patient. Unfortunately, because I'm an inspector, I see the other side of this when dental safety isn't implemented.
Mhm.
I walk into practices where the type of dentistry that's being delivered sometimes could be dangerous, right? Sometimes it could be a public health issue if things aren't addressed. And so I think that is where I see where it's really affecting, patient care. Um, Again, I don't know that it's always intentional. I just think that because there's not a lot of oversight and because we are trying to stay on schedule, that's part
Mhm.
of what we do. Get to the next patient, get to the next patient, get to the next patient. We do tend to overlook, a lot of the compliance rules and regulations that really allow us to deliver the safest dental visit possible.
Would you say that um, a percentage of the dentists, of the care providers, are not 100% clear on all of the regulations? Would that be part of it? Would you say some of it is that maybe a shortcoming in technical skill sets? Maybe they didn't master everything as fully as they could have through school and into early years in practice, or is it at speed they are just maybe not pausing enough to see certain things or be a little more careful? How much of it falls in any of those categories, or is there any other category other than those?
I would say all three. I definitely would say that it falls into all three of those categories. You do have a lot of clinicians who are just completely overwhelmed with all of the rules and regulations. There isn't enough emphasis when you're in dental school or dental hygiene school or dental assistant school to really thoroughly go through what are the rules and regulations, what am I supposed to be doing. You get very little training on infection control, and then that's it. The rest of your training time is focused on didactic, right, learning. And so that's not the school's fault. It's just you have a certain amount of time. This
Mhm.
person has to take a board exam,
Mhm.
state board exam, and they have to know, certain things in order to qualify to take this board exam. And so you only have so much time. I think some of the dental boards are trying to make up for that by requiring some of the infection control and OSHA courses to be a requirement for license renewal. So I think they're trying to make up for
Mhm.
that. You certainly do have, uh, just in general, dentistry is a business, so you do still have to make money, and so
Mhm.
that means you have to see a certain amount of patients, you have to have a certain volume,
Right.
and sometimes that volume can be so large that there are some things that just fall through the cracks.
Mhm.
And I would definitely say that, you know, for sure, a lot of it just falls into all three of those categories. Yeah,
Yeah.
definitely.
Yeah, I would be in agreement with what you were saying earlier that it's probably would be a very small percentage, I imagine anyway, that would willfully, intentionally
Yeah,
compromise. But then
yeah,
we are imperfect humans, right?
sure, yeah, 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 and that is true. I mean, I don't think that people deliberately want to do the wrong thing. I don't think that even those dentists and those practices that get reported are deliberately trying to harm people and things like that. I just think it's the nature of the way that our industry is set up. I think, like I said earlier, the oversight is very different. It's not the same in every single state. And so again, there's, gaps happen when you don't have like a federal standard, right? And so everything is state run and led. And so there's different requirements per state. So that's a whole nother kind of issue where, maybe it would be different if everybody was calibrated and everything was universal. It might be a little bit easier for compliance, but that's not the case. And so you also have clinicians that learn from different institutions. And so different institutions have a different emphasis on, compliance versus another institution. And so it really depends on where you went to school and, that kind of thing. And so I think that it is tough to be completely compliant all of the time.
Mhm.
However, I do still think that there's such a large gap that we need to close that gap a little bit more in our industry, because what's interesting about dentistry is that we don't track some of these breaches after, in patients, right, for patient outcomes after they've left the
Mhm.
practice.
Mhm.
Typically, somebody who comes in and has dental care performed, and then they leave, and if they get a respiratory infection a couple of days later, they're not attributing it
Right.
to potentially,
Right.
was it the bacteria in the water lines
Right.
from the dental office? They're attributing it to, oh, I was in the grocery store, somebody was coughing, or I was, at a party and somebody, I realized somebody was sick there and that's where I must have gotten it, or another family member was sick. So we don't really make the connection, and we don't really have the science to track where some of these how some of these infection control breaches are actually affecting patient safety. We know with bloodborne pathogen diseases, right, like Hep and HIV, because of the whole, big thing in the 80s with HIV. But when you're talking about some of these other diseases and infections and things like that, there's not really a direct connection. We're just kind of starting to get some more evidence with dental water lines and what that can actually do because of the different breakouts that are happening and stuff like that around the country. The
Mhm.
CDC has done a great job with really highlighting that, but we still have a long way to go. And I think that, someone like me who's out here and saying, hey, we have to start paying attention to this because it is a big deal. It is a public health issue if we are not implementing proper protocols for every single patient.
Yeah, we need to learn to prevent, right?
Yeah, right.
Yeah.
Exactly,
Yeah.
exactly.
Given all of that, you have some innovative strategies that you've developed and some things that you advocate for to help ensure safety in dental care. So can you tell us a little bit about some of that?
Sure. I think for what we do, yes, it's innovative. It's really about looking at the guidelines and creating a system. I don't know if in the past we've really approached it systematically, and I think it's important with the way that a normal dental schedule would go because it's so regimented. I think we have to look at infection control in the same manner and create a system. And so that's what I did. I created a system where it works with every single dental setting, whether it's mobile, whether it's, private practice, uh, dental service organization, hospital based. It's basically taking all of these protocols, putting them in certain steps, implementing that, and making it a team approach. And I would say, one of the biggest things that I think that dental settings could do would be to assign someone to run the program.
Okay.
There's a huge gap with these infection control programs and these protocols. And I think if you could get one person in the practice or the dental setting to be the infection control coordinator, that really starts to allow you to organize the program,
Mhm.
create a systematic approach with it, and then get it implemented so that it's maintainable and sustainable. And that's really a key, especially now that we're dealing with staff shortages. We're dealing with high turnover, things like that. People aren't staying at their jobs as long as they used to. And so what I tend to find is one person will be put in charge, and then if they leave, nobody else knows what to do.
Right.
And by having this one person implement a system, even if that person leaves, the system still stays in place.
Okay.
And so that's kind of been my approach, and it's been very successful for a lot of my clients across the country.
That's great. Yeah, I could see how it could too easily become in the midst of short staffing and high demand, time pressure for things that it would be one of those things that could fall by the wayside or just nobody has their eyes on it with enough commitment to make sure that it happens. So I like that. Somebody's responsible and yet the team is fully
Hmm.
involved. That's good.
Yeah, yeah, yeah. It's important because it alleviates the burnout on one person. Because it is a lot. There is a lot of things that are required to happen by law across the board, regardless of the state at a federal level. And then you have everything you're required to do at the state level. And so by making it a team approach, and when I say team, I do mean the whole entire team. Sometimes people think, oh, it's just the clinical side. No, it's administratively too. And if we could all approach it, we spread out the responsibility, we avoid burnout, we avoid resentment, those kinds of things, disagreements among staff. I do more work than you do, that kind of thing. But when we spread it out and it's a team approach, it creates this culture of safety in the practice that everybody has a stake involved, right? Everybody has a part to do. And what that does is permeate to the patient care, right? And then now you've got really safe patient care that's being delivered.
Yeah, that's great. Because it is kind of everybody's involved because it is a sink or swim together kind of thing, right? It's not
Exactly.
like
Yeah.
just somebody gets in trouble or
Right.
somebody contributed to a negative result. It's a team. It's a practice that somehow this was the result from that practice. So I think that's a good mindset to be able to see it as a group like that. Well, you talk about the ethical responsibility of dental providers to implement best practices, and we've talked about not being enough oversight really to do that.
Hmm.
For people
Hmm.
for people delivering healthcare to do that, irrespective of oversight.
Right.
So, how does this influence your approach to training and educating? And then also, how does this affect the trust between patients and care providers?
Well, I think ethically, that's what a best practice is. So a best practice is something you're going to implement regardless if someone's looking or not, right?
Right.
And so that is a main focus of all of my training when I deal with my clients because historically, the average client I have has never been inspected. They will never get inspected.
Mhm.
And so that because the oversight is very low, right, or little,
Mhm.
I have to deal with people who are looking at me like, nobody's coming in here, nobody's going to inspect us. We've never had, a complaint, things like that. But again, it goes beyond that because we want to make sure we're taking care of patients. So I do a huge portion of the training is focused on the ethical code of dentistry and what does that mean to us? And I break down different parts of the code, reminding us that we are obligated to do no harm to patients. We are obligated not to break the societal trust with our patients. And so some of us do need that reminder because it's been a while since we were in school and we had to take the ethics and
Right.
jurisprudence and all of that kind of stuff, right?
Right.
And so that is a big focus. I do a lot of reminding of my clients and their teams that, hey, this is someone's family member. What if it were your family member? What if it was somebody that you loved, right? You want them to be treated with the utmost respect. It is important for us to remember that our patients do trust us. They're not going behind to check to see if we're licensed or if we're, doing the right protocols and the practice and things like that. It is really our responsibility to do that. And because of that ethical code, we do have to make sure that we are implementing best practices. I think where we get tripped up sometimes is that because there's not a lot of oversight, we think we're in the clear.
Mhm.
And that is a lot of times when you'll end up getting a legal inspection or something like that, where you get just a little too lax with that. Because I will say, post COVID, patients are watching. They're
Right.
watching a lot more than they were before
Mhm.
COVID. They're very well aware of uh, what we should be doing as far as washing our hands, hand hygiene, or what type of PPE, things like that. So they are paying attention. They might not voice it all of the time, but they definitely are paying attention to what we're doing. And again, it just goes back to at the end of the day, as a healthcare provider, I want to be there to take care of my patients. I understand it's a business. I get it. Most clinicians get that. But it is first and foremost our responsibility to make sure that we take care of the health of that patient. And I think the only way that we can do that is, regardless of what that oversight is, we have to have a personal kind of philosophy, practice philosophy that we're going to do the right thing regardless if anybody is looking. And so that's what I really try to focus on when I'm doing my trainings.
Yeah, that's good. And I guess one of the key conclusions I would think is that, and what I'm imagining that you're saying is that you can attend to all these things. You can carry out that ethical safety responsibility, and you can in real time accomplish a successful business of patient care and do well financially in business while doing all of these things. That it's not a choice of I'm going to run a
Right.
great business or I'm going to be
Right.
really careful, right?
Yeah. Yeah.
So for everybody who's excuse me, that's been listening and thinking, I'm imagining there's people thinking, I don't think I have this covered. I'm not necessarily worried that I've done anything wrong,
Right.
but I don't know if I'm really on top of everything. And then there's others who, maybe should be somewhat more concerned. But
Sure.
just to be proactive, right? If people would want to know just where do I stand, what's the best next thing for them to do, or if they would like to find out more about what Learn to Prevent has to offer.
Sure. Well, certainly you could visit our website, and we have a free gift for anybody that visits the website. It's an inspection checklist guide,
Okay.
and you just download the guide, and it walks you through about 10 questions, and then you get a score. And you can kind of determine from the score, we give you, based on your scoring, we give you a scorecard, and we let you know, hey, if you fall in this range, this would be your next step.
Okay.
And so it's really been a helpful tool for a lot of people that have visited our website to really get an understanding of, hey, I need some more help, or I'm doing pretty good. I just need to make sure that I schedule my annual training. Because to go back to your point, it doesn't have to be an either or situation. You can do both. And that's one of the things that we try to help with. We simplify all of these complicated rules and regulations. We help you streamline it in our system. And again, that will allow you to be able to do both and have peace of mind so that you can focus really on what you want to do, your passion, which is taking care of your patients.
Yeah, that's great. And that sounds like one of the greatest possible benefits is the word simplification, right?
Yes, exactly, exactly.
I
Because
think,
that's the biggest,
right,
that's the biggest pain point. They're like,
right,
India, oh my gosh, all
right,
these rules and regulation. I had no idea,
right, right. When was I supposed to be staying nights reading
Right.
all of this?
Right, exactly,
Yeah.
exactly. Yeah,
This
yeah.
has been fascinating. We talked in the beginning about being enthusiastic about compliance and your passion, but I think it's very meaningful that you have found a passionate place here. There is a need that you've recognized and that you want to take responsibility to be a part of that solution. So I think that's a great thing. So
Thank
I
you. I
appreciate your
appreciate it.
time.
Thank you so much. Thanks for having me.
Yeah, absolutely. So I encourage everybody who's been with us to reach out. I like that checklist idea and to be able to see what your score is. I think that's a perfect way to help people see should there be a next step and what would that be. So that's very good. So I thank everybody for watching. This is Matthew Norton, and this has been the Truth Behind Dentistry. Today I've been with India Chance, and I hope you have found our conversation helpful, and I look forward to seeing you on the next episode. Thank you.